Hi, everyone. I'm your host, Liza Tillman, and today joining us is Dr. Dontre Douse. Dr. Douse is an ENT head and neck surgeon who will be joining the Southwell family in August at Southwell ENT. Thank you so much for joining us today, Dr. Douse.
Happy to be here.
So can you tell us a little bit about your family, a little bit about yourself, and what inspired you to become an ENT?
Yeah, so my name is Dr. Dontre Douse. I was born and raised in Savannah, Georgia, and all of my families there. I did my undergrad at Savannah State University and then matriculated into Mercer School of Medicine. And I also attended the Savannah campus of Mercer University. So all of my initial schooling was in Savannah. And then I was blessed with the opportunity to travel up to Rochester, Minnesota to do my residency training in otolaryngology, head and neck surgery at the Mayo Clinic. And as far as my family, I'm married now for 9 years. We have a beautiful daughter. She's 2, and we're excited about the move.
That's great. We're really excited to have you here in Tifton and get you started.
Right.
Yeah. So you just closed on your house?
That's true. Yeah.
Yeah?
We did. And yeah, that was a special process for us. It's our first home. So.
Oh, that's so exciting. Well, like I said, we're really excited to have you here in Tifton. Okay. What inspired you to become an ENT?
Yeah, so the first physician that I ever shadowed, Dr. Zoller in Savannah, was an ENT, but that didn't really, I guess it didn't really pique my interest as much at that time. And I went into Mercer thinking that I was going to do family medicine, and I was committed to do family medicine and pursue family medicine. And the reason why was because I enjoyed the interaction with patients. I enjoyed clinic. I enjoyed teaching and just building a lasting relationship with patients. When I got introduced to the operating room is when I then found myself in sort of this conundrum because I was like, well, I love surgery just as much as seeing patients. I played college football a little bit at Savannah State, and the operating room sort of kind of just reminded me of kind of the game day sort of feel, and it was a team environment and everybody's working towards the same goal. And so I wanted that as a part of my future medical practice. So then I, began to look at specialties that had a mixture of both clinic as well as surgery. And then I shadowed an ENT who specializes in head and neck cancer, Dr. Petrozelli, during medical school. And I sort of fell in love with the specialty at that time. And the specialty is attractive to me because it has such variety. You can see patients of all ages. And then there's a number of just pathologies that you end up seeing because unlike other specialties that have both a surgical and medical counterpart, the ENT is it. You do medicine and you do surgery and procedures. And so basically everything in the head and neck region except the eyes and the brain and the spine we deal with.
Wow.
So.
What ages do you see?
All ages from newborns. Sometimes newborns will have, noisy breathing and things like that. And so, we can do scope exams and make sure that their airways are okay. And then all the way to elderly. Like, for example, during my training, we've placed the cochlear implants in people who are over 100 years old, for example.
Wow.
So
that's amazing.
That and so all ages.
So you really do get the best of both worlds. You get that, like you said, that primary care aspect where you get to see all ages and then you get to be in the OR too.
Yeah. I was listening to a podcast when I was trying to decide, and someone likened ENT to the primary care of surgical subspecialties. And I always liked that because I had a special interest in primary care and serving the underserved and kind of sort of being on the front lines with patients. But then I'm also excited that we have skills to help surgically as well as procedurally.
Wow. Well, I know we're very, very excited to have you on the team here at Southwell to bring that much needed specialty here.
Right.
Because as far as I know, you're going to be the only one, certainly the only one in Tifton.
Right.
And I know that you're going to fill up really quick
Yep.
because I think the need is absolutely there. Tell us what brought you to Southwell and what are you most excited about in this new role?
Yeah. This has been sort of a burgeoning partnership that's been going on since I was in medical school. That's when I first met Miss Monica.
Yeah.
And she came to Mercer, and 10th Regional at the time was looking for an ENT. And just because of my faith, my personality, my personal mission to serve in an underserved region, I was interested to talk to her and see what all 10th Regional had to offer. And over the years, we continued to just stay in contact. And I met with Mr. Chris, president and CEO, and we've built a relationship. And I can tell that he is serious about patient care, serious about serving in an underserved area. And he's not deterred by the challenges of practicing medicine in a rural or underserved area. And so because of that, I feel like that aligned with my personal mission, which is to be the best that I can be, serve the patients, and serve patients in rural or underserved areas.
Yeah.
And we can sort of kind of marry those two visions with this practice.
So we're really glad that you decided to come to Tifton. I know that Monica, we're talking about our director of physician recruitment, is always looking for physicians. And it's most people probably don't know that recruitment on Monica's end starts as early as it did in your career. Sometimes we're getting people who have come from other places, but we are getting people who are right out of school.
Right.
And it's amazing that you did decide to come to this small town. And we're not too terribly small, but we're definitely not in Atlanta or Jacksonville.
Right.
And for our patients who right now have to travel very long distances, it's so amazing that you're going to be here to be able to bring that care. They're not going to have to go far to do that. So we really appreciate that.
Yeah. It helps. My wife has family in Albany, so about 40 minutes away. So she'll be able to connect with her family, and so it works for all of us.
Yeah. Well, we're glad you came back to Georgia for sure. Well, tell us what led you to develop such a special interest in head and neck cancer treatment.
Yeah. Well, most things in ENT, most ailments are either elective or, things that you can treat with medicine or some sort of procedure. Cancer care is unique because, it can kill people, unfortunately.
Right.
And so I personally have been affected by loss with my late father as well as my sister. And so those sorts of events in my life has led me to have an understanding of how cancer can impact a family, what cancer care looks like. And I just wanted to sort of be on the front lines of the fight against head and neck cancers.
Wow.
And then apart from the personal side, the clinical and the surgical side is very rewarding. Clinically, you're building a relationship with patients basically for life. You're seeing them for surveillance and follow-up visits, and you're seeing patients on what they feel like is their worst days sometimes.
Yeah.
And so just being a person that can be there with them and sort of going through that journey with them is something that speaks to me. Surgically, it's challenging. It's cerebral. There's no head and neck cancer case that's the same. There are different regions that you might treat, but every case is the same because everybody's anatomy is just a little bit different. So each case has different intricate sort of details and parts that kind of keep you thinking and keep you sharp, and it poses a different challenge every time. So from a surgical sort of standpoint, it is fulfilling in that way as well. So I always wake up, feeling pumped and energized, and I don't ever feel like any sort of case is just another case or like it's mundane. And so those things kind of together led me to develop a special interest in head and neck cancer care. And it's something that I was focused on all throughout my residency training, working to get extra cases and, being a part of multiple multidisciplinary tumor boards, whether it's about oral pharynx cancer or thyroid cancer or oral cavity cancer or larynx cancer. And so, I'm excited to treat that population in Southwest Georgia or Southeast Alabama. I don't know. I'm just excited.
Well, we're excited too. And I can tell just from your demeanor that you're exactly who I would want taking care of me. You just have such a calm presence. And I've had a history with cancer and my family and myself personally with thyroid cancer, actually. And it's just, it makes such a difference when you have somebody who's not there just to treat the person, the problem, but to take care of the family and everything else. And I can tell that you really want to bring that to the table. And I think that's gonna make a big difference in our patients' lives. So tell us what kind of services patients will be able to access at your clinic.
So I plan to practice the full breadth and depth of the specialties. So clinically, we treat things such as sinus infections, nasal obstruction, ear infections, hoarse voice, sinus infections. And then from the sort of procedural side or surgical side, really pretty much anything from like the ears and nose and throat, I guess. So from the ear side, for example, I'm hoping to offer cochlear implants and implantable hearing devices. From the nasal side, I'm hoping to treat nasal obstruction, whether that's with a septoplasty or functional rhinoplasty. Sinus surgery down in the South in general. There's a lot of just allergy and pollen and things that patients deal with.
Tell me about it.
Yeah. So I'm excited to offer sinus surgery, complex sinus surgery, revision sinus surgery. And then, we already kind of mentioned head and neck cancer, so I won't dive too much into that anymore. But neck masses, thyroid or complex thyroid diseases, I'm excited to, work with the general surgeons on those cases too. And just the full sort of breadth and depth of the specialty I'm excited to offer.
Well, I personally, so let's see if this falls under that. So when I was 17, I had deviated septum repaired and I had my tonsils taken out at the same time. I saw an ENT, didn't I?
Right.
Yep.
Right,
okay.
Right.
Yeah.
Sure.
So that's what people can come to you for. I think that's kind of the basic thing that we think of.
That's those are some of the more common things. I guess some of the more common procedures that we perform will be ear tubes for kids, tonsillectomies for kids or adults. Septoplasty is probably the third most common procedure we do for adults. But then apart from that, I'm interested in and plan to perform voice surgery.
Wow.
Sinus surgery, surgery for example, Zinker's diverticulums, which is a
haven't heard of that one before.
Yeah, that's a sort of a pouch that you can get. It causes some swallowing troubles for some patients.
Okay.
Neck dissections, laryngectomies, which will be for larynx cancer.
Wow.
And so,
you are going to be busy.
I am.
I can see it. I think that I'm glad I'm getting you now because I don't think we're going to be seeing you for a while because you've got so much going on. Does a patient need a referral to see you or can they make an appointment at your office?
Yeah. A lot of times patients have referrals to the ENT office. And that's because patients usually present to their primary care providers with nasal obstruction,
right,
which can present similar to just like a regular upper respiratory infection. So So in instances like that, usually you have some sort of referral, but there are patients that might have, let's say, a neck mass or a parotid mass, or their kid has had, multiple tonsil infections or multiple ear infections. Those patients can self-refer. It's okay.
Okay.
And, if there's something that I can offer, either medically or surgically, then we can chat about it. And if not, we can just have a discussion about, what next steps they can take.
Okay.
And then when they would be a candidate for some sort of medical or surgical procedure that I have to offer.
Okay.
So I don't mind.
That sounds great. Yeah, because there's some practices and specialties that really require a very specific referral, so anybody could call. But absolutely, if you have a primary care provider, they're probably going to be the one. If you keep complaining about something, they'll probably say, I think you need to go see Dr. Douse for this.
Right.
Okay. So that's
and it's good because you get referrals from kind of all over. We'll get referrals from allergists because patients with allergies who might need a sinus surgery. Pediatricians will refer in because they're the ones that'll see the patients with recurrent ear infections or tonsil infections, and then primary care providers will see head and neck masses, all over neck masses, parotid masses, things like that. Oncologists will, refer for cancer patients. Dentists sometimes are the first ones to identify oral cavity cancers. So I'll probably be working with a number of specialties and getting referrals kind of from all over. So I'm excited.
I'm telling you, you're going to be popular. I can just see it. It's going to happen. What makes your approach to ENT care different or unique?
Yeah. I think a few things. First, I would say my faith. And I try to sort of just treat everyone like I would want to be treated.
Yeah.
But then apart from that, one of my mentors sort of stressed this to me early in medical school, which is that you should treat every patient like they're your family member, like they're your mom or your brother or father. And so I try to do that with every patient that I come in contact with. I try to treat them like a family member. I try to think about what things they're going through and sort of place myself in that position. So I'm kind of there in the storm, so to speak, with them.
Yeah.
And so then that helps me make a decision, or offer a decision that the patient can relate to, something that we all kind of sat down and had a shared decision making. And then speaking of shared decision making, I think the last thing that I do is I really like to teach. And I think that's one of the things that I liked about family medicine. But I really like the opportunity to teach patients what's going on and what's wrong with them, and what sort of disease process they have. Because if patients can understand what's going on, then we can talk the same language, and then ultimately we as a team can decide. And so I really like that sort of shared decision making, and then empowering patients to make medical decisions for themselves with my medical guidance. And so that's sort of my approach. And yeah, I think those are things that probably, I guess, help me to stand out.
It sounds like it. Yeah. I think our patients are going to be lucky to work with you for sure. Yeah. So can you tell us about head and neck cancer specifically, and what does that scope look like? What's that going to look like in your practice?
Mm-hmm. Yeah, so head and neck cancer is sort of a large umbrella term to describe any sort of neoplasm or growth in the head and neck.
Okay.
And so growths in the head and neck can be benign or malignant. And cancer, when you use the word cancer, there's the sort of the undertone, the underlying meaning is that it's a malignancy.
Okay.
And so head and neck cancers can be wide ranging and broad. And so, for example, skin cancers, so squamous cell carcinoma, basal cell, melanoma, etc. So that's sort of one subset of a head and neck cancer, but then there are a number of other ones. So nasal cancers, oral cavity cancers, like in the mouth, throat cancers in what we call the oral pharynx, thyroid cancers. There are different neck masses that may be benign or malignant. parotid cancers or neoplasms and masses. And so all of those different sort of subsites have cancers that can be, or masses in general, that can be treated. And a lot of times it just depends on what the pathology is, like what type of mass we're dealing with, because then that'll guide sort of the treatment. But I'm interested in and happy to see patients with any of those sorts of masses or lesions. And I'm happy to sort of take care of those patients.
Okay. So they can all do that in your office. Well, tell us, how do you work with a patient once a cancer diagnosis is made? Because I think some people might be confused. Okay, am I just going to see you, Dr. Douse, or am I going to go to oncology?
Right.
What does that look like?
Yeah. So it is very wide ranging, and it sort of depends on the type of mass that they have. For example, a patient may have a skin cancer and they would see both me or a dermatologist or maybe even a Mohs surgeon, and we kind of can all work together as a team. For a lot of the oral cavity, oral pharynx or throat, larynx cancers, you really work as a multidisciplinary team with medical oncology, radiation oncology, surgery. I will be the surgeon on the team, for example. And so it's really a multidisciplinary approach to those types of cancers. Let's say a patient has a parotid mass. Sometimes people are shaving or they rub their face and they feel the parotid gland, they feel the mass there, and then they would like self-refer. In that situation, 80% of parotid masses are benign, and if I see them and I'm working them up and it's something that we can just take care of with me and the patient, then that's something we'll do. In the rare chance that it's a malignancy, then of course I would loop in radiation oncology, medical oncology, and then help come up with a multidisciplinary plan. So it kind of, to answer the question in general, it depends on the mass. There are some situations where I'm kind of taking care of everything, and then there's some situations where I'm the technician of the team, and I'm to remove the cancer, but then they should follow up for sure with medical oncology and radiation oncology to get additional treatment.
Okay. And the best part about that is that nobody has to travel for those things.
Right.
We can all do it right here in this very area that we're in. You can go see you at your practice down the street. And then if you had to go to the Anita Stewart Oncology Center, you could do that. Right. And that's wonderful that patients are not. And that's one thing I just really want to drive home is that I think we all think in South Georgia that you have to go to Atlanta and you don't, or Macon or Jacksonville or Tallahassee. Now there's some things that you may have to refer out for that, but the majority from what I've heard you say is that all of this can be performed in Tifton.
Yes. Yeah.
And that's wonderful.
Yeah. There are some things that I would refer out. For example, if a patient needed a larger, what we call free flap reconstruction, where you're taking tissue from another part of the body and bringing it to the head and neck.
Okay.
Those are things that I took interest in during residency, and I could do technically, but it's there are just some things that it would be wise for the patient to go to an academic center, for example.
Sure. Yeah.
So those patients will come sporadically, and we'll be able to chat about it. And if nothing else, if they travel to a larger academic center such as Emory or Mayo Jacksonville, I'm happy to see them when they get their treatment there, and that's great. I can sort of surveil them after that too. Yeah,
it's always nice to have somebody that's in your corner that you're familiar with at home, that you can ask questions to if you don't feel like you can where else. All right, well, thank you so much for joining us today, and I know we're excited to get this practice up and running. Tell us, what date will you start seeing patients in the office?
Well, firstly, thank you for having me.
Yeah, absolutely.
I appreciate being here. We'll start seeing patients August 25th.
Okay.
And to the viewers or the listeners, I'm excited to see patients and get a chance to work with some of the local providers here. Yeah. Some of the referring physicians and providers. To the patients, if there's anything that you're wondering in the head and neck region, any questions you might have or things that you want to look into and chat about, I'm happy to chat about it, and I'm happy to bring high-level evidence-based care to the region, and I'm willing to be a partner and teach, and I'm looking forward to it.
Thank you so much.
Yep.